Namaste.
Namaskar.
Every year, the Health of the Nation report analyzes data from health checks across Apollo hospitals to uncover patterns, risks, and emerging trends in the population, helping us to understand not just disease but early risk. What makes this report very powerful is that it just doesn't reflect disease, but it also reveals hidden gaps in how we interpret health itself. And today's discussion brings one such gap into focus, which is what we call the HbA1c trap. Here's something that people don't realize. This HbA1c test is indeed the gold standard test for diabetes screening. It measures the levels of glucose which are attached to the hemoglobin. But if the hemoglobin is low, the test viewed in isolation may not be quite so accurate. And considering that 1 in 4 Indians are, especially even in our cohort in the Health of the Nation survey, are seen to be anemic, this could mean that just looking at the HbA1c might be unreliable for people who are anemic. It could distort the results. So, a person with truly uncontrolled diabetes could get a lower reading, or it could be the other way. But it is not in any way we mean to undermine this test, but just to say that, tests cannot be seen in isolation and it should be also interpreted by proper medical advice and not by yourselves. So, to help us unpack this and make it more clear for each one of you, I am delighted to welcome Dr. Mahesh Chavan, who is a senior consultant, a senior endocrinologist with over 30 years of experience from Apollo Hospitals, Navi Mumbai. And he also has a particular specialty in pediatric endocrinology and hormonal disorders across age groups. His expertise includes thyroid disorders, treatment of growth failure, reproductive issues, and also always a focus on comprehensive long-term endocrine care. So I cannot think of anyone better than to unpack this for us. Doctor, thank you so much for joining us. So I want to begin by asking you this question about HbA1c because that was what came up in this report of Health of the Nation 2026. Of course, it's a test which is very reliable, widely used, easily accessible, but often prone to interpretation directly by patients. Go to a lab, measure your HbA1c alone, and then make your own conclusions. And we also have already seen that in the presence of anemia, this may not be the only test, and it might not truly reflect the glycemic status. So just wanted to ask you what are your interpretations about this particular fact and what would your advice to patients be?
Yeah. So first of all, HbA1c as such is a can significantly mislead the glycemic assessment in patients of anemia or those who are having red blood cell diseases. So mainly iron deficiency anemia may cause falsely high HbA1c and hemolytic anemia where the red blood cell gets destroyed where the HbA1c may be lower, so falsely lower. So the effect of anemia on HbA1c as such is that in iron deficiency anemia, the RBC survival is slightly prolonged, which leads to increased glycation time and falsely raising the HbA1c by up to 1 to 2%. Whereas in hemolytic anemia, which shortens the lifespan of RBC, the exposure to glucose is for a shorter period of time, and that leads to falsely low type of HbA1c. So we need to look at all this interpretation of HbA1c from the Indian context, where in India, anemia may affect up to 40 to 50% of Indian adults, and because of that, and particular type 2 diabetics, because of the multiple medications, they may further get affected with anemia, and all these contribute to a falsely high or falsely low type of HbA1c and make you a false sense of security or false panic when the
Panic.
HbA1c rises or goes down.
So, what would you advise? How do you encounter or how do you manage this discordance? How can this be approached?
So actually, this type of disorders should be managed by a stepwise workup where we rule out hemoglobinopathies by doing hemoglobin electrophoresis and rule out iron deficiency, and we are doing serum iron studies. And whenever there is any renal disease where the lifespan changes because of low erythropoietin, pregnancy, blood loss, transfusion, all these things can affect the HbA1c results. And that needs to be taken into account before taking the
Before.
history and interpreting the HbA1c.
Are there other similarly commonly used tests which can be misleading if they are not interpreted in the right clinical context? And how should clinicians, approach this with the patients? Because today there is so much of a tendency to self-diagnose, because today we have so many tools. We have AI, we have Google. People can take a lot of opinions. They can do their own tests. They can make their own interpretations, maybe even treat themselves. So, what would your advice to people be?
So there are short-term glycation monitors which we use during pregnancy is fructosamine and glycated albumin, which can reflect last 2 to 3 weeks of average glucose, which is useful when the RBC lifespan it cannot be RBC lifespan is abnormal and that cannot be relied upon, like anemia, hemolysis, pregnancies, chronic kidney disease. So the 1,5 anhydroglucitol 1,5 Ag is sensitive to the recent hyperglycemic excursions and especially postprandial excursions, and that can be used. Another way to monitor glucose is a continuous glucose monitoring system, which we can use and it will give a reading for up to 14 days, and it can give the trend of whether if the sugars are going high or low, and definitely and time in range, and rather than HbA1c, now we are relying more on time in range, time above range, or time below range, and the estimated HbA1c which you can come out of this type of test.
So I think the underlying message there is that you take medical advice, you take the right medical advice and follow, the right flow of tests and interpretations rather than just look at piecemeal tests and making your own conclusions. So you did mention some of the alternative markers and strategies that can be used. What would you like to tell our patients on, like not either getting too complacent or getting too anxious? So, what would be the best solution for them?
For patients who just don't rely on just one HbA1c report, I always advise to do a fasting blood sugar and postprandial blood sugar along with the HbA1c rather than just relying on one test. So HbA1c gives us an average of the higher quartile when the sugar is on higher side. It doesn't talk about the lows or the hypoglycemias which are happening. So just running behind HbA1c will land up the patient in hypoglycemias, and that itself can give rise to all the symptoms of anxiety, where low sugar can trigger tremors and sweating and all those things.
Right. So I think this is a very valuable insight that you have given, Doctor. Thank you so much. So it is very clear from today's discussion that just one number doesn't tell the full story. And context is everything in medicine. And that context is best uh, given to you by your doctor rather than any other source. So do not self-interpret, do not look at tests in isolation. And these findings from the Apollo Health of the Nation 2026 report will highlight this important message. And it is not just test-based interpretation, it is clinician-based, clinically integrated understanding that's more important. Ultimately, We should not be misled by just one number and one test. Trends are important. And with this, we encourage all of you to download the full report and rethink how we interpret health in today's data-driven world. To download this report, you can go to our website, www.apollohospitals.com. The link is in the bio. And for those on YouTube, the link is in the description. Thank you so much for joining us. Namaste.